Today we're going to learn about precision and predictive medicine, and this is for HAP 360. So precision medicine, what is it? Precision medicine is an emerging approach for disease treatment and disease prevention, and this is significant because it takes into account an individual's variability in their genes, their lifestyle, as well as their environment, and as a result it allows a more individualized sense of care. So an example of this are treatments designed specifically for targeted treatments designed for specific cancers and diseases. So predictive medicine. Predictive medicine is an approach that predicts an individual's risk for disease, and this is done through genomic biomarkers. And through the use of these biomarkers, it allows for early detection and, as a result, early treatment and prevention for the disease. And some examples include preconception testing, predictive risk testing, prenatal, and carrier testing. So the purpose of this Teach 1 assignment is to utilize data to determine which of these medications has the highest success rate when it comes to certain diagnoses. So question 1 asks us to create a table to determine the success rate of CIT for an individual or citalopram for an individual suffering from anxiety diagnosis. So in order to do this, we need to access our data, and we go to the Insert tab, Pivot Table, and as you can see, the data is already pre-selected. All we need to do is hit OK, and then this is where we select our data. So we want to compare generalized anxiety diagnosis, so we drag and drop to the rows column, and then citalopram success, which we drag into the column to the right, as well as into the values section. And then, since we're not calculating the sum, we're going to go to Value Field Settings and go to Count. And there we have it. And to calculate the rate of success, we need to divide the success individuals from the total individuals. So in this case, 117 divided by 366, and then we get 0.31 or 32%. So, as you can see here, the formula is written to calculate the success rate, and again we did 117 by 366. And the 117 is the number of patients who responded to the citalopram treatment, which was a success, and then out of 366 patients diagnosed with the anxiety or depression. Question 2 wants us to determine which of the medications has the highest success rate for an individual suffering from an anxiety diagnosis. In order to do this, we repeat the same steps for the citalopram success that we did earlier, just substituting it with the different medications. So once we have calculated the success rates, we can see that the citalopram had the greatest success rate of 32%. So part 2, question 2 asks, why is it as difficult to understand which medication works for patients with an anxiety diagnosis? And the reason for this is that every individual is different, and as a result, they react differently to different medications. One person may react in a good way, while another, it may not work, or it just has negative side effects. And because of this, there is no one medication or one universal medication that can work for anyone. And this is proven by determining the success rate of medications. And as you can see that even though citalopram had the greatest success rate, other medications did work for different individuals. So question 3 wants us to determine which of the medications has the highest success rate for individuals suffering from substance abuse. So in order to do this, instead of using generalized anxiety diagnosis, we substitute that with the drug abuse diagnosis. And so we just go back to sheet 1, and we go to original data, and we want to create a new pivot table. And this time, instead of generalized anxiety diagnosis, we put in drug abuse, and then we compare that with the different drugs. And then again, we change sum to count. And then to determine the rate of success, again, we divide success individuals by the total individuals. And as you can see, we get 31.3%. And then we would just repeat this step for every medication to see which has the highest success rate. And once we do that, we can see that BUP has the highest success rate at 37.5%. So this is the end of the Teach 1 for Precision and Predictive Medicine. I hope you found this video informative, and thanks for watching.